Hey everybody, welcome back to Burst TV. Today I'm here to give a little shout out to all the other registered dental hygienists out there that are cleaning their own teeth. Although I work for this company full-time now, I was once a clinical dental hygienist, and as they say, once a hygienist, always a hygienist. Okay, so I know this isn't the most popular topic of choice, but hear me out. The truth is, a lot of clinicians throughout healthcare are providing really great preventive and diagnostic services to their patients, but despite their recommendations to their patients, they don't get the treatment or preventive services themselves. So in my mind, I always go back to the old adage, the shoemaker's children go barefoot, or the cobbler without shoes. There's quite a few variations, you get what I'm saying. And while some think this is a reflection of a typical workaholic, others tend to think, look, if it doesn't bring money into a business, it's going to be put on the back shelf or pushed down a priority list. In past conversations with friends and fellow coworkers, we actually laughed about the fact that we were the most neglected and how nice it would be if we could actually have a real appointment with a full set of x-rays and a very thorough probing and cleaning. But then we'd go back to squeezing our own treatment in between other patients or when there was a no-show. And sometimes when I got in the chair, I felt like I was weirdly inconveniencing my work family, or that we were just rushed to get through it. So it got me thinking, I can't be the only one that cleaned my own teeth most of the time. So when I asked around, and yes, of course, I'm talking about doing informal surveys on Facebook because, well, I'm 40-something and that's just what we do. So here's some of the reactions, statements, and conversation and videos that came along after I asked my fellow dental hygiene friends, do you clean your own teeth? Why? And what's your favorite scaler?
So I love scaling my own teeth, especially around the lower linguals where, you know, that's where we get our buildup. So I just grabbed my favorite scaler.
So I actually have this Nevi that I got when I was graduating dental hygiene school, ADHA. Sent it to me in the mail as a graduation gift. You can see it's got this cute little ADHA logo there. And it's my favorite instrument. It's my favorite instrument of all time to use on myself and at work on my patients. And so it's never been to the office. I just keep it at home and I scale my teeth myself in between appointments because we all know it's so hard to get there. You can just use it anywhere. Anyways, I won't show you the back of my teeth down here because I have a permanent retainer and it's not cute.
Did somebody say do-it-yourself cleanings? That would be me. Super guilty. We are the worst patients to get in the chair just because our schedule is so busy. So I used to clean my teeth at home on the restroom counter until my daughter, who was 2.5 at the time, she reached for something behind me and I kind of, in my natural instinct, miscalculated my reach and I tumbled over and fell. And that put me in therapy for about 3 months. So I learned to never do that again. And now I just bite the bullet and clean it while I'm in the op with either an isolite or suctioning with the piezo when I can. Especially being in ortho, but I do get my teeth cleaned still once every 6 months. Ideally, I schedule it every 3 months, knowing realistically by the time I get around to it, it's once every 6 months.
So what else are we supposed to do to keep ourselves healthy besides clean our own teeth? And I trust myself, so I don't mind cleaning my own teeth, and I've been doing this many years. So there are 2 instruments that I really like to use when I have to really clean my own teeth. So I have the sickle, and I also have the Montana Jack from PDT. So these are my 2 favorite instruments, my go-to instruments when I need to really clean my teeth. And this is how I'm gonna clean them. You know, your smile is the first thing that people notice. So I'll just do this.
Gotta do what you gotta do. So here are some of the written responses I got. I'm going to read those first. It's just easier to quickly whip out the ultrasonic when I finish a patient early or someone cancels. We don't have any dedicated time for staff, so I do everything on my own time. I even take my own x-rays. No one wants to come in early or stay late, so I'm kind of screwed. The doctor won't let two people have empty chairs, so we have to sneak in quick prophy trade-offs when we can. Probably not the best, but better than nothing. And finally, 2 people told me they got real cleanings. They had staff appreciation and treatment days twice a year where everyone gets treated like a regular patient. And someone else said that they put it in the regular schedule and bill the insurance like usual. Most of us work full-time and have insurance, so as long as we aren't losing money, everyone is fine. Even though I schedule appointments 6 months in advance and I go in as a patient of the practice now, I still like to scale my own teeth. And my favorite scaler is the 204S. I can't see well, even with my glasses on. Like, my left eye is so bad. I could never wear loupes. Like, that magnification and everything always gave me terrible migraines, kind of like working on a microscope. So I've been working by Braille for 20-something years. I can literally close my eyes and scale my teeth. See that little piece of tartar? I don't want that in my mouth. I'm gonna take care of it myself. All right, so my final question for all you dental hygienists out there. If you are getting cleanings on a regular basis by another human being, do you still clean your teeth in between? Why, and what's your favorite tool? Leave us a comment. Thanks for watching, and we'll see you next time. All of the clinicians you see in this video are licensed, registered dental hygienists. They went to college to learn proper instrument selection, angulation, pressure, and technique for removing calculus from teeth without causing damage. They are trained professionals, so please do not try this at home.